My name is Dr. Hakan Paydak. I'm from University of Arkansas for Medical Sciences, and I have just had a presentation on the management of typical atrial flutter at the annual scientific sessions 2014 of International Academy of Cardiology and 19th World Congress of Cardiology. First of all, I would like to thank Dr. Kimchi for inviting me to give a talk on this topic that I've been working on over the last 12 years. Typical atrial flutter is a macro reentry that's confined to the right atrium. The management of atrial flutter consists mainly of anticoagulation because the risk of having a stroke for atrial flutter is 3% per year as compared to atrial fibrillation, which is 4.5% per year. The medical and the rhythm control, the rate control management of atrial flutter is more difficult to control as compared to atrial fibrillation because the AV node is bombarded 300 beats per minute and the conduction rate is most of the time 150 beats per minute. Most of the time we need to use a combination of beta blockers, diltiazem or verapamil and digoxin to control the rates. Since rate control is very difficult for the management of atrial flutter, we most of the time go for rhythm control. And before going for the rhythm control arm, though, we need to make sure that the patient doesn't have a left atrial or left atrial appendage clot by performing a transesophageal echocardiogram or making sure that the patients have been on warfarin treatment for at least 21 consecutive days with therapeutic INRs between 2 to 3 or one of the new oral anticoagulant agents. The rhythm control can be assessed, can be done in 4 ways. First, the patient can be tried to antitachycardia paced by either epicardial wires after bypass surgery, etc., or by transesophageal pacing parameters, which is rarely used nowadays. And the atria will be paced 20 to 30 beats faster than tachycardia cycle length, and overdrive pacing may terminate atrial flutter. This method was done by my mentor, Dr. Alwaldo, many years ago when he was at the University of Alabama and when he defined the entrainment. The second technique to convert the patient to normal sinus rhythm will be by chemical conversion. One of my other mentors from Case Western Reserve University, Dr. Bruce Stemler, did the initial work for utilization of ibutylite in this patient population, and he had success rate of 70 to 80% for converting atrial flutter to normal sinus rhythm. The third technique will be direct current cardioversion, which works 100% of the time. The risk of complication is less than 1%, but the main problem with cardioversion is these people have recurrence of atrial flutter, even when they are placed on antiarrhythmic medications with a risk of 50% in 6 years and then 90% in 2 years. The last technique to convert atrial flutter to normal sinus rhythm will be ablation. Ablation is a technique that was developed in 1995-96 by Francisco Cosio from Spain and Haseguera from France, and we started doing atrial flutter ablations after 1993. And the main focus of ablation will be to terminate the flutter, but also to look for bidirectional isthmus block to prevent recurrence of atrial flutter. If we don't look for bidirectional isthmus block, the risk of recurrence is 30 to 40% according to Dr. Nadir Saudi from France. But if we look for bidirectional isthmus block, the risk is less than 5%. Currently, American Heart Association, American College of Cardiology, and Heart Rhythm Society recommendations for the management of atrial flutter is to do a cardioversion as a class 1 indication. However, multiple studies have shown that ablation is better as compared to cardioversion plus antiarrhythmic medical treatment. And we believe that ablation is a safe procedure with a success rate more than 95%, complication risk less than 1%, and risk of death 0.15% according to a study that we presented at the American Heart Association meeting in 2013. Hence, we believe that the new guidelines should recommend flutter ablation as the first line of treatment as compared to DC cardioversion plus minus antiarrhythmic medication use. It's an important conference for number one, it's an international conference. It brings a lot of people from Europe and from Russia and from other countries. And also it's a more relaxed atmosphere as compared to other conferences that we attend and present, like the Heart Rhythm Society meeting or American College of Cardiology or American Heart Association meetings. And it's very well organized. I must say that everything is running like a clock, thanks to Dr. Kimchi and everybody who's contributing to this conference. This is the first time I've been at this conference, and I really liked it, and I'm going to recommend it to my colleagues as well.